Hello everyone and welcome to our very first video in our question series, and today we'll start with the cardiology section. So Yusuf, what question do we have today?
Alright, let's see. So before we get started, we recommend that you guys pause the video and give this a try. And when you're ready, you could resume.
I got it wrong! You need to teach me how to get it right.
Alright, sure, let's see. So here we have a 37-year-old man
Mm-hmm.
who comes to the clinic complaining of palpitations.
Mhm.
So it sounds like something cardiovascular, but it's a very non-specific symptom. And his medical history is unremarkable, and he considers himself healthy.
That
So-
sounds like a useless sentence.
Yeah, let's see. So his maternal uncle died suddenly at age 40. Now this seems...
Yeah, so
important.
that made me feel like, okay, this could be HOC-M.
Yeah, that's true.
HOC-M is hypertrophic cardiomyopathy for our audience.
Yeah, that's right. So yeah, this sentence seems quite important, and they also add that his cousin underwent heart surgery.
Yeah,
at
it
a
sounds
young
like
age.
something hereditary in the family.
Yeah, it could be hereditary. Let's see. So the physician asks the patient to sit upright, lean forward, and hold his breath in full expiration.
Okay, so I kept thinking about this a lot. Is this a clue? Does this help me in any way?
Well, okay, usually if the physician would ask the patient to do this because it makes it's easier to hear certain murmurs in this position. So when you lean forward, okay, your heart gets closer to the chest wall, and so it gets closer to the diaphragm of the stethoscope. So certain murmurs will be easier to be heard. And when you hold your breath, this prevents you from hearing the noise due to the air passing through the airways.
Yeah, the airway is just such a distractor.
Yeah, that's true. So holding your breath will make the sounds clear if there are any sounds coming from the heart, especially when you hold it in full expiration, because when you expire, of course, your lungs are going to be smaller. So again, your chest is less expanded and your heart is closer to the chest wall. So it would be easier to hear the murmur. So it's not a very specific clue. It's just that the physician asked
Yeah.
the patient to do this to see if there's any murmur that could be
So
heard.
it doesn't point us to a specific diagnosis, because
Yeah,
I kept
not
thinking about
yet.
that a lot.
Yep, not yet. But look at the next sentence.
Yeah, okay, yeah, look at that. Left sternal border. For me, that was a key word, like, it helped me diagnose, and it turned out to be wrong.
Yeah, that's true. Look at the next phrase here. So it's a decrescendo early diastolic murmur.
Yeah, I didn't
So there
pay that
aren't
much
many
attention.
diastolic murmurs, really. So this actually, for me, when I first looked at this question, this is how I eliminated HOC-M, or hypertrophic cardiomyopathy.
Yeah, I pegged HOC-M. I was just like finished. His maternal uncle died suddenly. He has a cousin with a history of heart surgery, so probably something hereditary. And I was just like left sternal border, because I know that if
Yeah, look at this picture here.
yeah, exactly. Like on the left sternal border, that's HOC-M.
Yeah, but there are other murmurs that could be heard in left sternal border as well.
Yeah, true.
So if we're talking about number 3 here, this is not the lower left. They didn't say it's the lower left sternal border. by
No,
the
they
way.
did not.
They just said sternal border. So like you said, there are 2 murmurs that we could hear here.
Mhm.
You could hear a crescendo, decrescendo systolic murmur in hypertrophic cardiomyopathy at here,
Oh, could you write that down?
this part here, number 3. Let me use the pen. So here.
So this is it's not a decrescendo. It's crescendo decrescendo.
Yeah, that's why, yeah.
But isn't that the same murmur of aortic stenosis?
Yeah, aortic stenosis is also crescendo decrescendo. Good point. But the aortic stenosis is heard here at number 1, the right second intercostal space.
Yeah. Okay.
And you could also hear aortic regurgitation here. But,
Okay.
But aortic regurgitation due to aortic root dilation, not due to a valvular problem.
What does that mean?
So if it were a valvular problem,
I wouldn't hear it on the same place?
yeah, you would hear it at number 3 over here, because the valve is more down over here, so it's closer to the left sternal borders. So if you have aortic regurgitation due to a valvular problem or valvular disease, it will be more easily heard at number 3.
So we have 2 areas for the aortic valve, aortic regurgitation specific.
Yeah, that's true.
Oh, that's cool.
So the next answer choice doesn't seem so bad. I mean, rheumatic heart disease could affect the aortic valve,
No,
and
but
you could get aortic
the
regurgitation.
dude is from the U.S.
Yeah, exactly. So when you get a question
Exclude,
stem
yeah.
that doesn't mention the country of the patient or that they're an immigrant or anything like that, you gotta assume that the patient is a U.S. citizen. So this kind of excludes dramatic heart disease. Also, the patient's history is unremarkable.
Uh-huh.
All right, and if you have rheumatic heart disease, it's much more likely to be in the mitral valve.
Yeah, true.
So
More than the
you'd
aorta.
get either mitral regurgitation or mitral stenosis,
Yes.
which is heard here at number 5. So it makes it
Dangerous.
unlikely.
Yeah, I excluded this. I didn't think about
Yeah.
it, to be honest.
And then bicuspid aortic valve, I mean, to me, this looks like a decent answer so far. I mean, if you have aortic regurgitation, it would suit the murmur the physician heard at the left sternal border and decrescendo early diastolic murmur.
Yeah,
Right, we
because
said
it's a
this
valvular
is-
problem, right?
Yeah, we said we could hear aortic regurgitation at this particular place. So at this place in particular, you could only hear 2 murmurs, like you said, hypertrophic cardiomyopathy and aortic regurgitation. But they said decrescendo, so you're just left with aortic regurgitation here.
But wait a moment.
Yeah,
Bicuspid aortic valve, as far as I know, leads to aortic stenosis. It could lead to aortic regurgitation?
that's true. The aortic stenosis in those patients occurs earlier because of the stress is only on 2 cusps instead of 3, so the 2 cusps like tire out more quickly,
Yeah.
and so you end up with aortic stenosis. But you could also get aortic regurgitation in those patients as the valves may not close more
Oh, I-
effectively like a normal.
I didn't know that.
aortic
I thought
valve.
it's always like aortic stenosis. That's why I excluded it.
Yeah, so that's something to consider. But the way I looked at this is, okay, so left sternal border, decrescendo early diastolic murmur. Just, it sounds like aortic regurgitation. There's nothing else. So I looked at the answer choices, and especially in a middle-aged man that has an unremarkable history, and he considers himself healthy, so he's not presenting with any significant features. He doesn't look sick.
Yeah.
So I immediately looked at the answer choices and thought, okay, what's the only thing here that has something to do with the aorta? C. So I looked at C, and then I started eliminating the other answer choices to make sure I got this right. And we usually read the last sentence first. So when I approached this question, I read the last sentence first at the left sternal border. This is where I started. And then I read the rest of the stem. So yeah, that's how I approached it initially.
Yeah, I get you.
Yeah. So
I could exclude the last 2 answers for you if you want.
sure, go ahead. So the infective endocarditis.
Yeah, at the start I was just like, what a useless sentence when they wrote that he considered himself healthy. But I was just like,
Exactly.
okay. Well, at the end I was just like, no, because now it can be infective endocarditis because those patients, like, they suffer from fever, chills, like, they're genuinely sick.
Yeah, they're gonna look very sick.
And the ASD, we explained it last time, and yes, we did not bring the answers the answer to the question ASD because that would have been a dead giveaway. So
Yeah, exactly.
yeah, an ASD would lead to pulmonic ejection murmur because you have a right side heart overload. So, and it would be heard like over the pulmonic area, which is like the second intercostal space on the left side.
Yeah.
So
exactly.
it's not that. So yeah. Okay, so if I were to approach this question right now, if I want to get it right this time, I'd basically, okay, let me get a new color here. Okay, so I just need to, I go like, palpitation, CVS. Okay, this turned out to be a distractor, which what I actually at the start was just like, I paid all the attention on. And I just gotta look at the murmur and the site of the murmur and just realize that this murmur is for the aorta.
Yeah. That's
And
right.
this is the only thing that has something to do with the aortic valve. And that's it.
Yeah. That's right.
Okay, good job, man. Thanks a lot. I really appreciate the help.
You're welcome.
Okay. So I
Anything-
think that's all what we have for today.
Yeah, that concludes our video. Thank you everyone for watching.